I just want to actually introduce Daria as very important for the whole Human Cell Atlas, because her career started in October 2016, and so one of the first things she heard about when she joined the lab was how exciting this project is. So you're going to report on the breakout session, but I'll just show a couple of slides to orientate you. I'm going to show 2 slides. I'm not sure what's in them, but we have made a certain amount of progress since the Atlas kicked off. There's great enthusiasm and integration amongst the dermatologists, people interested in immune dysfunction that affects the skin, and basic scientists. And a pretty good agreement about the types of samples we should be collecting and the variation that it would be important to look at. And this just actually addresses or goes to the point about the heart. One of the things we can do in the skin is use non-invasive imaging techniques. And the one that you can see here is a technique which is, it's like ultrasound on the surface of the skin. There is a probe that you can place on different body sites. It's used in the clinic for things like monitoring scleroderma progression. And the software behind it is ImageJ, which we all know and love from microscopy. And so we would like to be able to integrate data across scales. So here, this is the surface of healthy skin. We can see the separation of the epidermis from the underlying connective tissue, the dermis. We can measure thickness, variation. We can image the blood vasculature. And down here are a couple of heat maps which show that using this approach, you can distinguish differences in the thickness of the epidermis from a patient with psoriasis. The red peaks show you the deep areas of epidermal thickening compared to healthy human skin. So we feel that we have a lot of different possibilities here, and Daria will tell you about the follow-on from the breakout session.
Thanks, Fiona. So we had a very productive breakout session, I think, and a lot of it was as a recap for the progress that we made since the launch of Skin Cell Atlas, which was as early as the kickoff session of Human Cell Atlas in 2016. And since then, a lot of different bits of data has been acquired, and focusing on various subpopulations of skin cells. However, we feel like the effort has been very sparse, and there is no focused effort in place yet. So that's that's what the general sentiment in the group was. That's where the Skin Atlas needs to go as a next step, is bringing the collaboration forward and integrating separate work on skin from individual researchers and get them to share their protocols and upload their data to DCP when it's ready, or share among themselves. And the feel was that this platform for collaboration needs to be encouraged. A lot of researchers currently are doing skin research with different goals in mind. They're focusing on various subpopulations of skin cells, and maybe looking at skin in total, and for example, looking at age or ethnicity-driven variability. So a great suggestion was to create different versions of Skin Atlas, where people can put their research in a framework that is understandable for other researchers in the field. And another important point was to convene an international skin symposium, which doesn't quite take place as of date in the format that would be helpful to Human Cell Atlas. And a great example from DCP was lunchtime monthly talks, calls online, and a great suggestion was to release a monthly A4 sheet with the recent updates on the Skin Atlas field, and that would make it easier for new people to join in, and that would be easier for other people to focus their effort. Very beneficial for Human Cell Atlas would be to engage with current parallel initiatives studying skin diseases. And even though disease is not a focus of Human Cell Atlas per se, that would be very useful for the Skin Atlas, mainly for defining the normal state of skin, which might vary from what we currently think. So there's a lot of initiative studying diseases like psoriasis, cutaneous lymphoma, atopic dermatitis, and engaging with those researchers and inviting them to the dialogue would be very helpful because they already have not only the data but also the infrastructure in place, and that could be used by people who want to join HCA. One great example would be recent finding on melanocytes, on healthy melanocytes, that can be compared with melanoma patients, and that is a great example of collaboration between Human Cell Atlas and cancer research initiatives. Another platform that Skin Atlas would really benefit from is a developmental atlas, and making an accurate account of skin development and comparing that with adult atlas would be very useful as an add-on for people to use as a reference for scarring in skin and cancer development and skin organoids work. So overall, the progress in Skin Atlas has been good. We have pretty good understanding of the organ structure. I'm sure you all know it's very defined and layered in epidermis and dermis. And people have studied separate populations within that, this organ, and focusing on maybe different body sites or patients, variability between patients with different ethnicities or age. And the main goal for Skin Atlas is to bring all those efforts together and create a framework of Skin Cell Atlas. And that was it. Thank you. Thanks.
Okay, any comments on skin atlasing before lunch?
Hi. So I was wondering, skin is one of the, or like, is the largest organ of the body, right?
Yeah.
So what is your idea to, like, how you're gonna map the length and breadth of this organ?
Right, so what you're asking is whether we are trying to look at full organ.
Yeah, like, because different part of skin will have different keratinations and all.
So the issue of looking at different body sites versus same body site across different patients is a standing one. And for the pilot, Skin Atlas, I think the field now is that we're going from the logistical point of view and from the patient's point of view, because we obtain samples from surgeries. And so currently I think the field is to look at comprehensively at one body site. But of course, it has to be expanded to different body sites. It's just logistically difficult and ethically as well, because that would mean you would need to acquire, for example, biopsies from the same patient at different body sites, which is very rarely available. So currently, we're trying to look at various patients and comprehensively looking at one body site, or a few body sites, not one. So I'm sure Fiona has a lot to say about that.
Well, no, not about that, but I just wanted to pull up one of the things that we talked about, which was how different companies and different smaller charities can contribute to the effort. So I wasn't at the meeting in Israel, but apparently there was a lot of discussion about capturing the physical properties of the cell in different body sites. And we were hearing about new technology which is in the pipeline, which will, using a flow cytometry-based approach, make measurements of physical properties of cells beyond just size and shape. And we thought that there was a lot of scope for integrating the atlas with microbiome research and, for example, making arrangements where we could have donations from companies in kind, like sterile swabs for collecting material. So we were enthusiastic that the skin effort was naturally attracting a lot of different constituents who've got quite well-aligned goals.
So now, how big is the need to sample actually from different anatomical regions? Is the facial skin representative of, you know, your left leg? So what's the take there?
Well, it was shown a long time ago by Howard Chang that if you take skin biopsies from different body sites, grow them in culture for several passages, they still remember where they came from. You can pick them out by the Hox code. So there's spatial segregation, and there's also functional segregation. So it's obvious that most people's palms are not hairy, and their scalps are. There are quite interesting sex differences in skin, such that men and women who are matched by age and background and ethnicity who develop melanoma, the men will tend to do worse than the women. So there is a lot of need to look at different body sites and different ethnicities and sex and age.
Okay, if there aren't any more comments, I'd like you all to just join me one more time in thanking the chairs, reporters, and all the discussion participants.